Newsday continues here on One News Now. I'm Sean Yao. The IATF has submitted its recommendation on the quarantine restrictions after July 15. Let's discuss this further with Iloilo City Mayor Jerry Trenias. Good afternoon, Mayor. Mayor, can you confirm that the IATF will be recommending the shift of Iloilo City to the most restrictive ECQ status?
Yes, Sonia. I just met with the regional IATF composed of all the regional directors for the ILG, for DOH, for OCD, for NEDA, for DTI. And the common denominator is that everyone is in agreement with all the LCEs. All the LCEs will be making an appeal. So when you talk about Region 6, there are 6 provinces, 4 in Panay, 1 in Guimaras, and another one in Negros, no? And 2 highly urbanized cities. So there will be 8 LGUs that will be asking for reconsideration, because the recommendation of the national IATF is to place Iloilo City, Iloilo Province under ECQ. That means that the whole province of Iloilo and the whole city of Iloilo will be placed on lockdown, the highest form of lockdown. All the businesses will be closed. There will be no public utility vehicles. Jeepney drivers will be out of job. Same with taxi drivers. Only the groceries and the drugstores and restaurants for takeout will be open. So a lot of people will be out of jobs. We talked also to the SWD and inquired whether they are prepared to give assistance. And they said that they are going to inform their central office that they are not prepared to give assistance to everyone who will be affected. We met with our ITF, Regional Interagency Task Force, and all the data was clarified. And it was very clear that while the hospital, the healthcare utilization rate in Iloilo City was up, 60% of the patients came from the other provinces, not from Iloilo City. And it is of no fault on the part of Iloilo City that the hospital beds for COVID were full, because 60% comes from the provinces. And we cannot stop any patient coming from the different provinces who will be coming here to Iloilo to go to the hospitals.
Right, Mayor. Mayor, we understand the situation in the Visayas in general, at least in your region and nearby provinces, where you have other residents from other provinces going to seek medical treatment in Iloilo City. But for Iloilo City in itself, how bad are the cases there on the ground, just in Iloilo alone?
The cases are going down.
Okay.
And shown by the records of DOH, the cases are really going down. It is really the healthcare utilization rate that's bringing us down. And the patients, 60% are coming from the provinces, and we have no control of that.
Right. What about the vaccination drive there in the city? We understand, of course, that here in Metro Manila, for example, it's stalling a little bit based on hesitancy and supply issues. Are you experiencing the same down there in Iloilo, sir?
Well, in the NCR plus 8, they're talking now of the herd immunity. And the spelling of herd is H-E-R-D. Here in the provinces, we are also talking about the herd immunity. But the spelling is different. It is H-E-A-R-D. So we only have heard about the immunity. We cannot do anything because we do not have vaccines.
You don't have vaccines, or meaning is the supply very slow, or do you not have fresh supply for now? And
Supply is very slow. They promised that they came up with this NCR plus 8 plus 10, and we are included in the plus 10. But up to now, we have not felt the plus 10. We can vaccinate. The highest, I think, is 10,000 a day. But the last time we were given vaccines for second doses for AstraZeneca and second doses for Pfizer, but only 5,000 both for first and second doses of Astra. Meaning to say that we can only use 2,005 of the 5,000.
Right, that is a very small amount, Mayor. How is vaccine hesitancy there? Are people in Iloilo City willing to get vaccinated despite the lack of supply? So is supply really the main issue? You don't have any issues with hesitancy?
At the moment, we have not yet reached that stage. That there will be more vaccines for less people who want to be vaccinated. We have already pre-registered about 300,000 out of the targeted population of 450,000. So a lot of people want to be vaccinated. It's only the lack of vaccines that's holding us.
All right, noted on that. Mayor Jerry, thank you so much for your time and for giving us a situation from on the ground. That was Iloilo City Mayor Jerry Trenias on the phone. Thank you, Mayor. And the Health Department has reported over 3,800 COVID-19 cases on Wednesday. This has brought our total infections to 1,485,000, some 44,000 of which are still active. 140 new deaths were confirmed overnight, pushing the death toll to 26,200. On the other hand, we have total recoveries now at 1,414,000, with 6,200 new survivors logged in the last 24 hours. And the Education Department has listed down tentative dates for the opening of classes this year. Secretary Leonor Briones said blended learning for the academic year 2021 to 2022 could start either on August 23, September 6, or September 13. Briones explained that the final decision rests on the hands of the president as the country remains under a state of calamity. The DepEd also reiterated that there are no final plans yet for the resumption of face-to-face classes here in the country. However, Secretary Briones shared that vaccine czar Carlito Galvez Jr. has vowed to start vaccinating students and teachers against COVID-19 by August.
By August, perhaps at the latest, kung ma-vaccinate ang ating kabataan at particular ages at saka yung ating mga teachers, pwede na sigurong i-consider yung pinopropose namin palagi na i-pilot ang FES to FES.
And the MMDA says that traffic along EDSA has reached close to pre-pandemic levels. And Traffic Chief Bong Nebrija joins us via Zoom for more details. Good afternoon, Sir Bong. Yes, we have experienced this traffic ourselves. So what could be the reasons behind this? Is it really attributable to the tollway or Skyway 3 starting to charge fees?
Actually, Sean, we need to speak with the San Miguel Corporation and the Skyway 3 management to get the numbers from them, because they will be the one to have this. How many vehicles have been reduced in using Skyway 3 since they started charging toll? And not all of these vehicles who will be displaced out of this Skyway 3 will be passing through EDSA anyway. If you could see all their on ramps and off ramps, there are the closest is Quezon Avenue, but the rest are really far away. So that's why when we heard that they will be starting charging tolls, and what we prepared are the inner roads or the mabuhay lanes to accommodate whatever spillovers that they will be having. Well, I think it started on Monday. So that's what we did. So, however, the volume on EDSA has been increasing since we've been easing the quarantine status in Metro Manila. As of now, we have opened up 70% of the businesses, and we eased up restrictions, and families could go out now. So there are more people using the roads, not only for working, but also for leisure purposes. And since the increased capacity in businesses, even the malls are accommodating more people. So that's really the reason why we have also seen an increase of volume on EDSA. But just like what I said, we are already 98% of the pre-pandemic volume. We are now at 399 compared to the 405,882 that we had December of 2019. So the difference is when we had the 405,000 in 2019, EDSA was almost at standstill and could hardly move. And that was a Christmas season numbers. So now we're just still in July, we have 399. But as you could see, yes, we have so many volume, but the traffic is still moving. So that is good news. That's why we're monitoring, continuously monitoring the travel speed and the travel time on EDSA, so that this will also be the basis if ever we would re-implement the number coding again.
That's right. I was going to get into that. So we're hitting almost, or you're saying 98% of pre-pandemic Christmas numbers at that without the number coding scheme. Is the MMDA looking to re-implement this anytime soon given the state of the pandemic?
To be honest with you, Sean, we are already talking about it. But like what I said, we need to base it on numbers so that we will not be making mistake in implementing this. We do not want to be urong sulong. Ano? For example, but the capacity on the bus public transport system that we have on EDSA is still 50% capacity. So if we will be removing 20% of the volume on EDSA, we will just be putting these people to the crowded bus stations already, since the capacity hasn't changed yet. So we do not want to inconvenience, particularly our frontliners and the health workers, in implementing the number coding, because they will be the one who will be first affected by this. And so we're talking about number coding already, to tell you honestly, but we haven't seen the numbers that will force us to implement it again.
All right, we'll just wait for that update, sir. But I'm curious because during the pandemic, when the roads were fairly empty, some changes were done along our major thoroughfare. Of course, I'm talking about EDSA. You know, the bus lane has moved and there is now a motorcycle lane where the bus lane used to be. Did these changes impact traffic in any way based on your observations as early as now?
Well, the transformation of EDSA is really working well for all the road users of EDSA. For example, the bike lanes that we have instituted on the right side, the EDSA busway on the left side, the busway particularly, the commuters are benefiting for this. It has cut off their travel time by almost 50%. And the bike lane is an added protected lane for bikers and personal mobility device users in going to work. And this has become an alternate mode of transportation in going to work, particularly those who are just living within the 15-kilometer radius of their work and home. Now, instead of bringing cars, spending for gas, spending for parking fees, and wasting time on traffic, they would rather just take their bikes, and it would be more convenient.
All right, well, looking forward to what the future holds for us. And for traffic, thank you so much for your time. MMDA Traffic Chief Bong Nebriha over Zoom. Thank you, sir. For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Wash hands, masks on, wash hands, and stay safe, Philippines. I'm Sean Yao. We are One News.